In this session, we are going to learn about the Premier Health Saver Plan. Keep in mind as we proceed that I will be discussing the preferred plan unless I specifically express otherwise. The Premier Health Saver pays the same benefits when you receive covered services at any medical provider in the nation, but this is a PPO plan which offers contracted prices when you receive care from a network provider. This means deep discounts without haggling, and PPO providers are contracted to file claims on your behalf. Healthcare Pals is a free concierge service available to all Philadelphia American policyholders. They schedule medical procedures for you when possible and negotiate prices whether in or out of the PPO network. They will inform you of optional bundled services available from companies that specialize in your needed procedure, which can save thousands of dollars. Since the Premier Health Saver pays the same dollars for benefits regardless of the patient's responsibility, these savings mean more money in your pocket. Sometimes, there is no time to schedule procedures, and out-of-network services can result in balanced billings. Healthcare Pals will negotiate on your behalf to have balanced bills reduced or eliminated. Premier Health Saver policyholders have free and unlimited access to a licensed doctor around the clock and all year long, from telemedicine. This plan is best suited for people who are interested in saving money, both in premiums and out-of-pocket expenses, and therefore willing to pay attention to what services cost and whether services are medically necessary. Together, we can begin fixing the broken healthcare system in America. The Premier Health Saver is a private health insurance plan, underwritten by Philadelphia American, a New Era life insurance company, which is rated excellent by A.M. Best Company. Since the Premier Health Saver is exempt from ACA requirements, policyholders don't have to reapply for coverage each year. It is guaranteed renewable to age 65 when Medicare eligibility begins. And, because it's not an ACA plan, also known as a major medical, policyholders don't have to pay for coverage they don't need, such as maternity. There are no copays or deductibles to meet before benefits are payable. Being exempt from ACA mandates also means Philadelphia American's Premier Health Saver is medically underwritten before approving coverage, and pre-existing conditions are excluded during the first 12 months of coverage. This results in a healthier risk pool, which translates to premium savings for you. Now, let's dive into the policy benefits. The benefits explained here do not include the additional benefits offered when policyholders bundle this plan with other plans, such as the Enhanced Accident Policy and Specified Disease Plan. This policy provides a $5 million lifetime benefit. That's $5 million for each person covered by the policy.
The annual benefit limit options are $250,000, $500,000, and $1 million. Once again, remember that the Specified Disease Plan adds an additional $250,000 or $500,000 annual benefit for covered claims, and the Enhanced Accident adds another $30,000 for accident claims. Same goes for critical illness benefits. These are the deductible choices, which can vary by state. This is not a true deductible because the policyholder doesn't have to pay the amount of deductible before receiving benefits. The deductible simply reduces the amount of benefits the policyholder receives from two line item benefits, that is, the hospital room and board or ICU benefits. The maximum number of deductibles a covered person must meet per calendar year is 3. Here is an example of how the deductible works in the brochure. Multiply the daily hospital room benefit by the number of days confined overnight and subtract the deductible, then add the hospital admission benefit. The hospital admission benefit varies based on the deductible chosen. There is no hospital admission benefit in some states, such as Tennessee, which has no deductible either. There is no limit on the number of days a policyholder can receive hospital room benefits, but there's a limit of 20 days for ICU benefits. Unless you see specific limits for an item or items in this brochure, the only limits that apply to benefits are the annual and lifetime maximum benefits. That is an important and huge benefit, because most competitors have strict limits on hospital days, and how much can be paid for specific claims. The preferred plan provides an additional hospital admission benefit, after the deductible has been met. Look at the generous daily hospital room benefits, especially with the preferred plan. Now look at the average room rates according to Kaiser State Health Facts. This benefit is intended to cover all expenses that occur inside the hospital room, including miscellaneous items. The next item listed is the confinement in a hospital for mental illness, alcohol and/or substance abuse dependency indemnity benefit. This is a daily benefit and is not subject to the deductible. Multiply the daily benefit times the number of days in a month and you will see how generous this benefit can be. Most ACA plans provide this benefit only with network providers. The benefit for confinement in a rehabilitation facility or a skilled nursing facility does not include mental illness, alcohol and/or substance abuse dependency, as was just explained. This is a daily benefit which is paid first dollar, meaning there is no deductible or copay before this benefit is paid. Good luck finding a policy with benefits more generous than what you've seen thus far. Thus far we've been discussing benefits while confined to a hospital. The next couple of benefits are for outpatient services. Later on we will discuss a category called additional outpatient benefits, which has a separate annual maximum benefit limit. That limit does not apply to the benefits paid for outpatient hospital or ambulatory surgical center services when surgery is performed. The only limit which applies to this benefit is the annual maximum benefit selected for all benefits, $250,000, or $500,000, or $1 million. Later on we will discuss wellness benefits and specifically colonoscopy benefits. You will hear that when polyps are found and removed during a covered patient's colonoscopy, the procedure is recoded as medically necessary versus a wellness benefit. This is when preferred plan pays $5,000 lump sum benefit to cover the facility charges, regardless of the actual charge. In a moment we will discuss benefits for professional services which will also relate to this example. The medically necessary colonoscopy. But before leaving this section, let's analyze the outpatient radiation therapy, chemotherapy, and immunotherapy indemnity benefit. This is a daily benefit, not subject to any deductible and is limited to a $50,000 annual benefit. Don't forget also, that in addition to these benefits, the specified disease plan pays 100% of the UCR charges, after the deductible is met, up to the annual benefit amount selected for that policy. All benefits listed in the policy are payable, regardless of your doctor or hospital being a member of the PPO network. This is important to know because network discounts average 54% nationwide and can be as much as 80%. The policyholder gets to keep benefit payments that exceed actual charges tax-free. Check with your tax advisor to be sure. There are also specialty centers around the country which can save patients a great deal of money, or in this case, putting more money in policyholders' pockets. Look at the daily benefit here. That is 100% to the policyholder if the bill is paid in full by another policy. With that in mind, you may have figured out the insurance hack. Suppose for a moment that I have big-time cancer claims that are dragging out for months, maybe years. Knowing that Philadelphia American Indemnity plans pay exactly what the policies state regardless of patient responsibility, I would buy an ACA plan during open enrollment also. The ACA plan is guaranteed issue during open enrollment, meaning I can't be turned down for medical reasons, and pre-existing conditions are covered on day one. 2 or 3 daily radiation chemotherapy benefits or 1 surgery benefit would likely cover my ACA deductible and out-of-pocket expenses. Then I'm covered 100% by the ACA and still receiving huge benefit. Instead of being ruined financially as a result of cancer, I will likely have enough money to live comfortably while I recover. Speaking of surgery, that falls under the professional services category. I'm going to skip the first item for now and come back to it. So let's look first at the surgery indemnity benefit for covered services when performed in a hospital or in an ambulatory surgical center. That's a mouthful, so let's break it down. When surgery is performed, regardless of whether it's done in a hospital or at an outpatient facility, and regardless of whether or not the facility is part of the PPO network, the benefit is paid based on the Medicare allowance for that procedure times 3, assuming the preferred plan is selected. There is no deductible or copay or coinsurance required before this benefit is payable. The benefit is payable even if the bill is paid in full by another source, such as the enhanced accident policy, the specified disease plan, or an ACA plan. This is huge. Really huge. Here is how another agent explains this benefit.
There is a Medicaid reimbursement schedule that Medicare pays the hospital. Our Unit 1 plan pays the same as Medicare. For a little bit more premium, you can go to a level 2 plan, and it pays 2 times what Medicare, the reimbursement schedule is. And then our level 3 plan, which again is the Cadillac plan, it pays 3 times what Medicare Medicaid reimbursement schedule is. In order to be able to describe this a little bit better, what I did is I took one of the pages out of the Medicare Medicaid reimbursement schedule. The federal government has basically a book, and there's about 7,000 items on there. The one that I like to basically talk about is the hip replacement. And this is based on the mean charge, which is pretty much nationwide. Now, this is without any insurance. You can expect to pay somewhere around $75,874.
Deep discounts are contracted when using a PPO network provider. First Health is the PPO network in 2023.
Now, here in southeastern Wisconsin, the discount we're getting is about 44%. So the discount and this is the chart for our area here, the 7-county area of southeastern Wisconsin. If you went in with no insurance, $75,000, whether you had a Unit 1, a Unit 2, or Unit 3, you're going to get the same discount. Take that $75,800 down to $44,007. Now, here's our Unit 1, which pays the same as Medicare. It pays $20,486. Now, that's the reason why I suggest never sell the Unit 1 plan, because even though it's better than nothing, you're still going to have about $24,000 out of pocket. Not really what you want to sell to your clients, especially for those that are looking for a health plan, a really good health plan. But just take a look at level 2 plan. And that's why I say these plans are so unique. And I think, like I said, they're bar none the best value in the country as far as health plans out there. After the network discount, you got $44,000 due on that hip replacement. Unit 2 will pay $40,000, just right around $41,000, just short of $41,000 against $44,000. You're going to still have about $3,000 out of pocket, but just think if you had an Obamacare plan, let's say you had a $6,000 bronze plan, that would leave you with about $9,600 out of pocket for this procedure. But even our level 2 plan is going to leave you a little more than $3,000. That's why I said these plans, you can set these plans up against any product out there, and you can see that this plan really does pay the level 2 plan 2 times the Medicare reimbursement. The level 3 plan, which will pay the Medicare reimbursement schedule times 3 units, it'll pay $61,458 against, after the network discount, $44,000. So that means that particular client is going to walk away with about $17,000 in their pocket, tax-free. The level 3 plan, the reimbursements are unbelievable. And the level 3 plan is still priced about 40% less than you're going to find on the Affordable Care Act.
Inpatient pathology/radiology benefits for covered services are also paid using reference-based pricing. This is huge, especially on the preferred plan. Most group health insurance companies are using reference-based pricing in some fashion, but the most common factor is 1.5 times the Medicare allowance. The surgeon is not the only one getting paid for surgery. The assistant surgeon is also paid for covered services as a percentage of the surgeon's fee. For example, if the surgeon's benefit is $10,000, there is an additional $2,000 benefit to cover the assistant surgeon's charges. The same goes for the anesthesia benefits for covered services, which is also based on the surgeon's benefit. You may recall earlier when discussing a medically necessary colonoscopy that I referred to additional professional services. Well, this is it. The anesthesia benefit could be payable in addition to the facility benefit. I skipped the inpatient physician's care indemnity benefit, because some people confuse this benefit with the physician's benefit under the other outpatient services category. When medical care is from a physician, other than an operating surgeon, while confined to a hospital, the daily benefit shown is paid. There is no limit for the number of doctor visits while confined to a hospital. The only limit is the annual and lifetime limits previously discussed. The outpatient physician indemnity benefit is the first item under the heading, Additional Outpatient Benefits. Unlike everything we've discussed thus far, the items found under this heading are subject to a separate policy year limit, per covered person. The limit you see here pertains only to the items listed in this section. Outpatient benefits are paid, first dollar. There are no copays or deductibles to meet before benefits are paid. Preferred plan policyholders receive up to 8 benefits listed in this section, per calendar year. If a person is needing an MRI or other diagnostic evaluations due to an ailment, the procedure can be scheduled. Savvy policyholders will contact Healthcare Pals to schedule procedures, or they will utilize services such as Green Imaging. Green Imaging has locations in most cities, and they are adding new locations all the time. Outpatient diagnostic testing is the most abused in the healthcare arena. Patients often, unwittingly, give medical providers a blank check when it comes to diagnostic testing. This is understandable since most patients are apprehensive about questioning their doctor, and are afraid that something serious might be developing. However, your doctor should not be offended by your desire to protect your finances by shopping for services or soliciting the help your insurance company's concierge service. You should be smart when it comes to using the emergency room as well, since this is when and where most outrageous diagnostic claims occur. If a policyholder goes to the emergency room for a reason unrelated to an accident, and is not admitted to the hospital, the benefit is what you see here. On the preferred plan, it's $400 for the facility. That's it. Any amount over that is the patient's responsibility. The urgent care center benefit is paid a maximum of 2 times per insured person per policy year. If the patient goes to the emergency room and is not admitted, that will also count as one of the patient's urgent care visits for the year. The prescription indemnity benefit pays exactly as the brochure states, regardless of the cost of the medicine. The last item to discuss are the wellness benefits. Once the policy has been active for at least 60 days, Philadelphia American will pay $250 for a wellness visit. An additional $250 is available for mammograms annually. There is an additional colonoscopy benefit. During the first 3 policy years, Philadelphia American will pay $500 for a wellness colonoscopy. This benefit increases to $750 in year 4. Unlike a major medical policy which limits a colonoscopy to once every 10 years for adults who are at least 50 years old, Philadelphia American will pay this benefit every 3 years. A wellness colonoscopy is when there are no symptoms prior to the colonoscopy, or discovered during the colonoscopy. If polyps are found and removed, the colonoscopy is no longer considered for a wellness benefit. It is coded as a medically necessary procedure which receives the facility benefits and so forth previously described.
Now you know all about the Premier Health Saver plan. Stay tuned for a comparison between this plan and the Health Saver Plus Gold.
Daryl, I've had 3 surgeries in the past 12 months, and cannot express how pleased I am with Philadelphia American. I have been so happy with the checks they send when they cover more than what was charged. This helps me pay my bills, and they send them very quickly.